That it is very important question. We, as a nation, we have to come up to this, and we have to address the health disparity and the stigma that it is coming with the pain. We have an opiate pandemic. It's killing thousands of our young patients. But we shouldn't let that cloud our judgment when we have a sickle cell patient. We have heard it from many patients who told me personally, there is nothing hurt me more than the pain of sickle cell than the pain of someone who doesn't believe me when they go to the emergency room. So I think the way to address this is actually by data. We have shown in previous studies that the number of deaths from opiate overdose in sickle cell population is less than the death from overdose in patients who have other chronic disease. So that's an important fact to publicize. Two, the CDC has actually made an exception for sickle cell disease similar to a cancer patient because this patient deserves to be treated appropriately. The third, which is very important, is education. We have to educate our emergency room, physician, nurses, and even many other in the hospital about how this patient pain is actually important to be believed. We have to build that relationship with the patient so we can believe them because they tolerate pain and they express it physiologically different than other patients who never had any pain and they are just coming now for the first time. So, and final things, it's really by science. We have to find out better way to understand how can we measure that pain, whether a newer medication, newer biomarkers that could make this a little bit easier to treat.